It's up to you. It's up to you. This serious question. Just kind of frustrated. Okay, I'd like to call this meeting to order on February 19, 2026, special meeting of the Board of Directors for the Healthcare District. Pledge of allegiance, please stand for the pledge of allegiance. I pledge allegiance to the flag of the United States of America and to the republic which stands one nation under God, indivisible, with liberty and justice for all. President Carmela Garnica? Here. Director Trina Thornton? Ms. Thornton, you're muted.
Apologize. Present.
Thank you. Ms. Thornton, is there anyone at the age of 18 or older present in your location?
They all are leaving or out the door.
Thank you.
The last one's leaving right now. Bye. Have a good evening, Mike.
Thank you.
You're welcome.
Director Sandra Hudson? This is an opportunity for citizens to speak only on items listed on the agenda. For the record, please state your name. The board has a policy of limiting any speaker to not more than 3 minutes. Public input may be offered on the agenda items when they come up for discussion and or action. Is there any public comment?
Once again, the board of directors, I'm sorry to sense a little bit. Once again, the board of directors has committed a serious and entirely avoidable governance error, one that puts Palo Verde Healthcare District at immediate regulatory, legal, and patient safety risk. The board is attempting to suspend the duly adopted Palo Verde Hospital medical staff bylaw and replace it with RUHS medical staff bylaw, which contains materially different credentialing, certification, and accreditation requirements. This action was taken without any request to consultation with or vote by medical staff and without adequate notice for meaningful review. I received this proposed suspension only last evening. This sudden concern over the medical staff officer election is especially troubling given the board's own record of bylaw non-compliance. In 2024, Carmela simultaneously assumed the role of the board chair and treasurer, widely understood as a move to prevent board member Sandy Hudson from oversight of financials. More recently, the board failed to conduct its required annual officer election altogether. Although, against that background, this selective enforcement of the bylaws appears arbitrary and pretextual. Let me be clear, the medical staff bylaws are binding contract, not an internal policy subject to unilateral action. Section 15.5 explicitly states that this bylaw constitutes a mutually agreed, legally binding contract between the board and medical staff. Any unilateral suspension, replacement is breach of contract and therefore void. Adopting the RUHS bylaw immediately would strip privileges of many physicians in the ER who are not board certified or board eligible. This would create, since it says it will be enforced immediately upon adoption, the emergency department will have physicians who are not credentialed, a violation of the Title 22 Joint Commission standard, which is for RUHS, and DNB, which is for Palo Verde Hospital. Two different accreditation that is also the problem. This also violates CMS regulation for conditional participation, opening the door for potential regulatory shutdown. The board has not produced any complete version of proposed bylaw for review, avoiding any suspended government document or not one that has ever repeated its indefensible governance. Finally, the existing bylaw mechanism address affiliation or revision. Section 15.6-1 and 15.6-2, for example, governs combined medical staff and the hospital associate as affiliation, ensuring orderly process without unilateral action. In conclusion, this action is invalid, pretextual, contractually breaching the medical staff contract with the board, and will have legal consequences. I have another public comment, but since I have 3 minutes, I'm going to have another lady read my public comment, and I will be available for any question, but I will.
Any more public comment? Mark?
Good evening, Madam Chair, board members, staff, and our community. Leslie Jessup Watkins. I just want to take the opportunity to thank Jeff Bangwagon for being here tonight. I think that it's been a long time that this community has been waiting for what we hope to be today's step off of the revival and survivability of the hospital. I'm just very grateful for today, and hopefully you can get through your meeting and find some consensus with regard to having the county here to pave the way forward for this community. It's not for the hospital, it's for the community. So thank you, Mr. Bangwagon, for being here.
Any more public comment? Okay, seeing none, we'll move to board comment. Oh.
Joshua Coleman. Be quick because this is a bit long. Earlier this week, I asked Director Hudson to champion a single amendment to the bylaws that I've drafted. The amendment requires a monthly register of warrants. In plain terms, makes the district's checkbook visible to the board and to the public. Board Clerk Joe Gonzalez wrote to Director Hudson that President Garnica denied placing this item on the agenda for the next regular meeting. One reason given was that President Garnica felt that it should wait until the 2 vacancies were appointed. The Brown Act Governing Code Section 54953, 54.2 requires a public business be conducted openly and properly agendized. It does not grant unilateral veto authority to the board president for a legislative request from the state. Legislative authority rests with the board collectively, not with just one officer. The denial by President Garnica is not supported by statute or by ordinance. Also to note that this board is following Rosenberg's rule of order. Under those rules, authority rests with the majority of the board. The chair simply facilitates proceedings. The chair does not exercise independent legislative power, as was seen in the denial to place this item on the agenda. The justification given was that the board is not full membership. Governing Code Section 1780 governs vacancies. It does not suspend the board's authority to amend its bylaws. A quorum of seated members may act unless the bylaws explicitly require otherwise, and the current bylaws do not. Implying that this board needs 5 members to decide whether to publish a list of its own disbursements elevates routine transparency into something controversial when it is not controversial. It's basic accountability, and it does not become more legitimate simply because 2 more chairs are filled. It's a delay, nothing more. The proposal by the board tonight does not overhaul the bylaws. It merely requires that the checks, ACH payments, wire transfers, credit card disbursements, and payments be listed monthly as identified publicly. It provides transparency of the district's finances. The district is currently petitioning the courts for bankruptcy, and the public and board have little to no visibility on how this government agency is spending taxpayer money. From a local perspective, Palo Verde Unified School District, Palo Verde College, and the City of Blythe all provide registers of warrants with the regular meeting agendas. We know what these agencies are spending on because we have a line-by-line record of those expenditures. Nearly every public agency in California includes a register of warrants in its regular meeting material. With this agency, its director or a member of the public wants to know what is being paid and how much, they must request that information. I've made many requests, and at least one has taken 133 days to fill. Of course, those are the ones that have not been simply denied by using an improper reason for denial. It is not normal for an agency to provide a register of warrants. Public confidence in this board is low, and the primary reason is a lack of financial transparency, something that can be cured by providing a register of warrants. Again, really every agency in the state does. The register of warrants is not some radical idea. It's normal for government agencies to provide this information. Blocking it sends the wrong message. I would ask the county to use for that this board institute a perfect requirement to provide a register of warrants. And there's a big gap.
Okay, moving on to board comment. Let's see. Trina, do you have any board comment?
Starting, you're muted.
Hi, apologize. Good evening. I wanted to touch base on the recall, and I wanted to request, if possible, if the board secretary could read that to be put on the record.
Starting, that is not an item on the agenda. We do have
Okay, so under public comment, board comment, then I can just speak, and then I request for that to be placed on the agenda for the next meeting, please.
Thank you.
You're welcome.
Susan, do you have any board comment?
I do. I have a couple of things on my mind tonight. One, I'd like to thank Jeff and William for being here. I appreciate it. I appreciate all the effort on the county's behalf and the city. I think that everyone's tried their very best to make this go forward. I think the problem lies in the fact that this board is so divided in our approach and what we believe is the right thing that we've had some difficulties. And I believe that if you're going to ask me to vote on anything, you should provide me all the information. And I should have time to read it, ask questions, contact an attorney if I need to or want to. And that just doesn't happen. It was a 70-some page document last night that I got home to it, got sent at 5:30. There just isn't time to analyze it and to review it and to make a qualified decision on that. So if there's anything going forward, let's have it all be current and let's have it all be fair. Just like Mrs. Sarton is wanting the recall information put on the next agenda, I would also like the check warrant to be put on the agenda. These are reasonable requests. I asked that Mercy Air be allowed to speak to the public here at the Oslo board meeting. That was denied. These are not self-interest. These are public interest questions. And I would hope going forward into the future that they are addressed. Thank you.
Okay, I have a public comment. A board comment. As president of the Palo Verde Health District Board of Directors, I would like to correct statements made by Director Hudson and Dr. Sanobi regarding legal fees paid by the district. Alina Roberts was paid $518,191 for services as the district general counsel from January through October 2024. And additional payments were made from October through December of 2024 for wrap-up work. In 2025, SBEMP and Lena Wage were paid a total of $547,882, with Lena Wade serving as the district's general counsel during the period. The district maintains copies of checks and financial records substantiating these amounts. We believe it is important that the public have the accurate information regarding district expenditures and accountability in all financial matters.
Well, I'm going to follow this. Since you addressed me, I'm going to follow up with that. First of all, I made no such statement as that. And second of all, anything that Maria Roberts was charging for were lawsuits that we were involved in. I think you were told those. That is a difference in direction. But I made no such statements to the finances because I've been asking the last year and a half to see the finances and haven't been able to see anything. So to say that I know which number is not correct.
Okay, next item. Item 4, approval of the agenda. Is there a motion to approve the agenda?
Also move.
Is there a second?
I'll second.
Call for the question?
Should I get started?
Aye.
Director Hudson?
Aye.
Thank you. President Gardena?
Aye.
Thank you.
Okay, action items. Review and approval of minutes. Minutes 11/19/2025 special meeting. Minutes from 12/17/2025 special meeting. Minutes from January 7th, 2026 emergency meeting. Minutes from January 7th, 2026 adjourned emergency meeting. Minutes from January 9th, 2026 special meeting. Is there a motion to approve the minutes?
I so move.
Is there a second?
I'll second.
Call for the question?
Director started?
Aye.
Director Hudson?
No.
President Gardena?
Aye. So I have a statement. Good evening, everyone.
I'm sorry, why don't you go ahead and call the agenda item and then that will just.
Oh, yeah, okay. County of Riverside Management Service Agreement. And Ms. Wade, Michael Rose.
You can go ahead and.
So before we continue with tonight's agenda, I want to say something to our colleagues from the County of Riverside, some of whom are here with us now. As we all know, the district has faced severe challenges with the hospital throughout the past 18 months or so. Throughout this period, the County of Riverside has remained present, responsive, and committed to the people of Palo Verde. Their willingness to step in and drive the truck and the technical expertise, financial support, and ongoing collaboration has provided critical stability at times when the hospital and community face the possibility of the hospital and community clinic being permanently closed. We are especially grateful for the critical assistance from County Supervisor Manuel Perez, County Executive Officer Jeffrey Weinreich, Jennifer Crickshank, the CEO of Riverside University Health System, and their team. Amid significant uncertainty and deep concern in the Palo Verde Valley community about the hospital situation, one thing has been clear all along. The county supervisors and staff have done everything they could to save the hospital, and our community will always remember that. We are open today because the county helped us. People are employed because the county helped us. And we are very grateful that we can continue providing this service to our community. Thank you so much.
We're also grateful to the city for their financial assistance. Yes.
Thank you. So with respect to the management service agreement, if you'll remember, there was a loan agreement in the amount of $1 million to the county that stated that a management service agreement would follow. That was one of the requirements. So it's been negotiated as authorized by the board. Yesterday morning, it was finalized and the board packet was put together and circulated. So I've requested that Mr. Van Wagenen here with me today so he can speak about the management services agreement and talk about how critical it is that this move forward at this time.
Members of the board, thank you very much for having me this evening and good evening. As indicated, my name is Jeff Van Wagenen and I'm the executive officer for the County of Riverside. And it truly is my pleasure to be with you here tonight. I am here, although alone, I am representing the full county tonight. Supervisor Perez, his colleagues on the Board of Supervisors, our Riverside University Medical System, our Emergency Management Department, County Council, and the County Executive Office. For the last 6 months, the county has been working tirelessly with a number of partners, as indicated, to make sure and preserve emergency medical care here in the Palo Verde. We've been working with the City of Blythe to thank those council members and city manager for their help and participation, the Governor's Office, the California Department of Public Health, the California Department of Healthcare Services, United States Senators Padilla and Schiff, Congressman Raul Ruiz, Assemblymember Jeff Gonzalez, and State Senator Steve Padilla have all been engaged, as has the American Medical Response Ambulance Providers, the Desert Care Network, Eisenhower Health, England Empire Health Plan, La Paz Regional Hospital, and others. That just names a few. Over the last several weeks, Riverside County and the Palo Verde Healthcare District's lawyers and consultants have been working daily, in fact, often many times a day, to find a path that protects emergency medical access for the Blythe community. Tonight represents the culmination of those efforts. The management services agreement that you have before you tonight reflects what we committed, what the county committed to publicly on January 14th. Time-limited, focused, responsible intervention to protect public life, health, and safety. This is about stabilizing emergency care, not changing ownership, not assuming debt, not rewriting history. Keeps the emergency department open and safe while we assess what comes next. On January 14th, the county made 3 commitments. We would not allow the Blythe community to lose emergency access without exhausting every reasonable option. Any intervention by the county would be limited in scope and duration, and the district will remain the licensed hospital operator. Those commitments remain intact today and are reflected in the agreement. On January 27th, the Riverside County Board of Supervisors reinforced that direction at the meeting in item 3.39 on their agenda, authorizing the executive office and me to move forward with a stabilization strategy focused on the Palo Verde Emergency Department clinics and ancillary services. The MSA you have before you is the operational framework to implement that direction. So what does this agreement actually do? Put simply, it stabilizes operations. For approximately 120 days that we begin on Monday, February 23rd, assuming the adoption of the MSA this evening, an RUHS-led county strike team will provide on-site operational management. The focus is the emergency department, the clinic, and support services that are necessary to keep emergency care functioning. The team will assess and manage current conditions. What this agreement does not do, it does not transfer hospital ownership. It doesn't transfer licensure. It doesn't make the county the hospital operator. It doesn't make hospital employees county employees, or make the county responsible for the district's past debts or bankruptcy obligations. The district remains the licensed operator. The district retains total responsibility, and the district retains billing authority and regulatory responsibility. This is delegated operational management, not a takeover. The structure we built and put in place and that you have before you this evening was intentional. We know the community needs emergency care continuity, but the county must also protect our taxpayers and operate with legal authority. This agreement attempts to strike that balance by allowing county professionals to manage day-to-day operations necessary to prevent service interruption. It also preserves the district's legal and regulatory responsibilities. It keeps financial assistance governed separately under the loan agreement framework and establishes a defined start date and initiative 180 days out. Again, this is stabilization, not absorption. What should our residents expect? The emergency department to remain open, clinic services and essential support to continue, improved operational coordination, closer emergency medical services alignment and communication, professional management presence focused on patient safety and compliance. You should also expect transparency. This is a 180-day assessment window. At the end of that window, recommendations will be brought forward for long-term decisions. I'll say a word about the RUHS-led strike team. The strike team will bring emergency medicine leadership, operational management experience, finance oversight support, nursing leadership, quality and compliance support, and the mandate is relatively narrow: stabilize, assess, report, recommend. Not here to permanently run the hospital. Why is this necessary? You know as well as I do, and probably better than I do, that the district is facing severe financial strain. You're in Chapter 9 bankruptcy. There are regulatory and operational stresses, and significant risk of the emergency department closing. If the emergency department does close, our residents may face emergency transport distances of more than 70 miles. This is not acceptable from any public safety standpoint. This agreement prevents that outcome, at least in the near term. This agreement includes clear limits on county liability, clear preservation of the Palo Verde Health Care District licensure responsibility, defined authority boundaries, termination protections if patient safety or regulatory compliance is jeopardized, and transition provisions at the end of the term. This was drafted carefully by both legal teams to protect all parties, and most importantly, the patient. I want to acknowledge for the community that this has been difficult. It's been a difficult process for the residents. It's been a difficult process for the patients. It's been a difficult process for the board members, and it's been a difficult process for the hospital employees. By all accounts, you have a lot of good people doing good work all day, every day, trying to preserve medical care in this community. Tonight is not a something way. Rather, it's about stabilizing care and protecting lives. Is this 180-day assessment the long-term solution? No. This agreement creates breathing room. It allows our professionals to help evaluate the operational sustainability, financial realities, clinical staffing models, regulatory exposure, and long-term structural options. I want to say a word briefly on what happens if the MSA is not approved tonight. I think there are three immediate threats that put the existence of the continued operation of the facility in jeopardy. First, by our estimation, the hospital, the emergency department does not have enough money to last beyond this month. Number two, you have frustrated vendors that are put simply fed up. Because of the county's assistance over the last several weeks, we have assisted in getting, and with our partners at the Desert Care Network and La Paz Hospital, necessary vital supplies, things like blood and other supplies have flown to this hospital because of our assistance. I think the most dire example of the challenges we face, there's a vendor that provides the CT scanner to the emergency department. That vendor has not been paid and is threatening to come and, for lack of a better term, repossess the CT scanner. You don't have a CT scanner, you don't have an emergency department. Because of our existing relationship with that vendor and the thought that the county is coming to try and assist, we've been able to hold them at bay, but I don't know how much longer if this MSA is not approved. And finally, I want to say a word about the intergovernmental transfer and participation in state revenue funding. As this district knows very well, the hospital had to make a $3.5 million payment in mid-December with the hopes that that $3.5 million would return roughly $9.9 million to the hospital for operations. That payment was disallowed by the Department of Healthcare Services. Informally, we have been having discussions with DHCS trying to keep that opportunity still alive, that beach ball up in the air. We've been working with DHCS. DHCS has been, as indicated, they would look favorably upon the county taking management responsibility under this NSA and the county making $3.5 million in that payment so that the district could draw down the $9.9 million for hospital operations. We have a meeting scheduled tomorrow with DHCS, and that meeting is going to go one of two ways. We have good news where you want us to wire the money, or we have bad news, and I don't know what to tell you. So those are real threats. In closing, the Blythe community deserves emergency medical access. This agreement gives us 6 months to stabilize care, restore confidence, gather facts, and bring forward responsible long-term recommendations. It is measured, it is limited, it is legally sound, and it is focused on one thing: protecting the health and safety of this community. Thank you very much for the opportunity to say a few words about the MSA. I'm asking for the district board to approve it. Thank you.
Okay, and with that said, is there a motion to approve? Sorry. Is there any other comment?
Evening, Madam Chair and everyone. Mr. Van Wagenen, again, I don't even know how to put into words how grateful I am to have the county here. It's been a long time coming. As the former owner of Blythe Ambulance Service, everything that he speaks with regard to emergency services and the need in this community is true. There's not one question in this room or in this community with regard to that. And the fact that they've already started working with DHCS for the IGT monies that we already spent almost $500,000 to not get speaks more volumes than we can even say. And we do need to pay our vendors. We do need to keep that CAT scan operational. So I implore you, please make this a unanimous vote tonight. I know that there's some things within the contract that are maybe not favorable to some people, but we have to think of the entire community. And that's what's before you. Thank you again, Jeff.
Okay, so any more public comment?
Yes, I'd just like to echo what Ms. Watkins said. Thank you, Jeff. I don't know if you work hard. He's got 1,400 jobs to do, and this one just added one more, and it's amazing what they've come up and doing so. But there's still one more hurdle, and Jeff, it has to go in front of the bankruptcy court. They'll get their approval after the 9th.
It's not my party, so I don't know the rules on answering the questions, but I can simply say that the MSA, if approved, we would begin operations. And we will also be going to the bankruptcy court, but it's not a condition that has to be solved.
That sounds good. So
It's not to get approval, it's just to get acknowledgement and a rubber stamp for the bankruptcy.
well, thank you. But that speed is up a little sooner than, so I appreciate it. But Jeff has done a hell of a job, and I don't know how to appreciate it. Thank you for being here tonight. That helps a lot to advance our public. Thank you.
Any more public comment? Okay, any board comment? Trina?
I just want to also thank, the city of Blythe for their assistance and all they did to loan the hospital district money. And I also want to thank Riverside County University Medical Center for all their support. And Jeff Van Wagenen, thank you so much for being here tonight. And advocating for emergency services and to keep the services going for our community. Really grateful to you for that. Thank you. Thank everyone that's been a part of this.
Okay, Ms. Hudson, you have any board comment?
I've said my thank yous and shown my appreciation, and I mean that sincerely. Thank you.
Okay, I have no board comments. So is there a motion to approve the resolution?
Oh, I'm sorry. There's one edit to the resolution. Joanna has made copies. It was made by county council earlier today. And it is in section 3D. There's a new sentence that says, county RUHS medical staff and district anticipate that the RUHS medical staff bylaws will be implemented over a period of approximately 45 days. This will allow the county RUHS medical staff and district sufficient time to collaborate on the applicable provisions needed to effectively stabilize emergency department operations.
Okay, so the motion, oh, we did that. Okay. Call to the question? Oh, okay. Is there a motion to approve the resolution 2026-01, approving the management services agreement with the county? I have a second.
I'll second.
Call to the question?
Director Stardom,
Aye.
Director Hudson,
Aye.
President Ortega.
Aye. Okay, next item on the agenda, item C, the resolution, and I want to thank the two board members, Hudson and Son, for approving
No, that's
this.
a good
County, thank you so much.
It passed.
So we move on to item C,
We worked for 6
continuing
months now.
resolution.
When the agreement passes, that's a good thing. That means the county's taking over. It means we're doing our job.
Continuing resolution of 25-26 budget, Mr. Michael Rose, interim chief financial officer.
Good evening. The district is currently operating under a continuing resolution for fiscal year 2026, as the budget gap has not yet been closed to achieve a balanced budget. A renewal of the continuing resolution is necessary. For any questions of the board, I'd like to invite Ms. Burke from Burke Consulting to answer, and I believe she is on Teams tonight with us.
Thank you, Michael.
Hey, Ms. Burke.
Can you hear me?
Yes.
I'm here. Can you hear me, Michael? Okay, great. He's looking at the
Yes, I can
screen,
hear
so
you. Yes,
I'm
I can
happy
hear you.
to take any questions or from the board.
There's no questions right now, Ms. Burke.
Okay, thank you.
So we will go on to approving the report. Oh, public comment. Okay. Is there any board comment? Is there any board comment? No. Certain?
No board comment other than I'm grateful for everyone's help. Thank you.
Certain? Yeah, I have none either. Okay, is there a motion to approve the resolution number 29? Oh, I'm sorry, public comment. No public comment. Okay, let's move on. Now, is there a motion to approve the resolution number 2026-02, continuing expenditures and revenues in accordance with the fiscal year 24-25 district budget and new fiscal year 2025-2026 budget adoption?
I'm so moved.
Do I have a second?
I'll second.
Question?
Director Stardom,
Aye.
Director Hudson,
No.
President Ortega,
Aye. Okay, next item on the agenda, closed session, public comments regarding closed session. Okay, no public comment. Okay. The hospital quality assurance report in closed session is pursuant to Health and Safety Code, Section 32-155. Item 2, conference with legal counsel regarding existing litigation pursuant to Government Code, Section 54-956.9 D1, Palo Verde Healthcare District, Chapter 9, Bankruptcy, U.S. Bankruptcy Court for the Central District of California, Riverside Division Case Number 625 BK 17084. Item 3, conference with legal counsel, significant exposure to litigation pursuant to Government Code, Section 54-956.9 D2, one potential case. Okay. We're now going to close session. Zoom into open session. Ms. Wade, do you have?
Yes, I will report out regarding closed session. Item 1, hospital quality assurance report, no reportable action. Item 2, conference with legal counsel regarding the bankruptcy, Chapter 9 of the district, no reportable action. Item 3, conference with legal counsel, significant exposure to litigation, no reportable action. Thank you.
Meeting adjourned.
Good job, everybody.
Thank you.